Hello and welcome to this presentation on getting started with Medicaid school-based services. This is Masuma with the Medicaid SBS Technical Assistance Center. We are excited to host the second presentation along with the Centers for Medicare and Medicaid Services and the U.S. Department of Education. For today's webinar, we will cover the objectives. We will describe and discuss the initial work of states to move into adopting more Medicaid SBS by starting with a comprehensive review and analysis. Then we will talk about opportunities for information dissemination. And finally, we will move into a discussion about getting your state's coalition off the ground and discuss some of the ways that you can make that work effective right from the start. This webinar is intended to inform state Medicaid agencies and state education agencies on the initial steps to getting started to enhance Medicaid SBS in their state. By the end of this webinar, you should be able to reaffirm that your state policies regarding special education students and Medicaid school-based services are consistent with existing federal laws, identify the changes made in 2014 from the issuance of CMS's State Medicaid Director Letter on Free Care, describe the roles that SMAs, SEAs, and LEAs should have to begin Medicaid SBS enhancement, define what education and resources SMAs and SEAs should provide to promote implementation or enhancement of Medicaid SBS, and outline the considerations and action steps to build a coalition to address the Medicaid SBS work. With that, I will turn it over to Katie Neese from the U.S. Department of Education. She is the Deputy Assistant Secretary for the Office of Special Education and Rehabilitative Services. In this capacity, she serves as an advisor to the U.S. Secretary of Education on matters related to the education of children and youth with disabilities, as well as employment and community living for youth and adults with disabilities. She will be talking about the reason we are embarking on this work to increase access to Medicaid SBS. Katie?
Thanks so much, and good afternoon, everyone. In response to the horrific school shooting in Uvalde, Texas, Congress and President Biden developed the Bipartisan Safer Communities Act that became law in June of 2022. The Bipartisan Safer Communities Act directed the Department of Health and Human Services to collaborate with the U.S. Department of Education to assist states on specific activities designed to increase access to school-based mental health services. Specifically, the law requires HHS and the Department of Education to issue guidance to state Medicaid agencies, local education agencies, and school-based entities to support the delivery of medical assistance to Medicaid and CHIP beneficiaries in school-based settings. There are four specific things I wanted to highlight that are required. One, that we needed to update the 2003 Medicaid School-Based Administrative Claiming Guide and the 1997 Medicaid in Schools Technical Assistance Guide. We needed to clarify that payments made to school-based entities under Medicaid for delivering assistance under Medicaid be consistent with the federal special education law and the free care rule that was issued in 2014. And we also needed to outline strategies and tools to reduce administrative burdens on and simplify billing for school districts and to support federal compliance. At the same time, we were tasked to establish this technical assistance center that's designed to assist states, state Medicaid agencies, school districts, and state departments of education to provide assistance under Medicaid. And the task of the TA center is to reduce administrative burden and support school districts and school-based services for obtaining payment to obtain Medicaid reimbursement and to ensure ongoing coordination between school districts regarding the provision and payment of Medicaid services. And one of the most important things, or among the most important things, was to provide direct assistance to rural and small schools that may have thought that this was an activity that was just beyond their reach. For school-based services, there is a specific responsibility for interagency coordination at the state level. And we want to use this opportunity to provide state Medicaid and education agencies with the technical assistance for them to access Medicaid to provide school-based services. As you may know, there are two distinct groups of Medicaid enrolled children who can receive school-based services. Children who receive services under the federal special education law, known as the Individuals with Disabilities Education Act, and then all other children. For IDEA enrolled children, as a condition of receiving federal special education funds, a state must ensure that there are interagency agreements among the State Department of State Education Agency and the state Medicaid agency. And these agreements must ensure that Medicaid is the payer of first resort for IEP services for a student with a disability, that the state education agency must resolve any payment disputes so that there is no cost to the child's family, and that if Medicaid reimburses the education system for any special education service, Medicaid is prohibited from reducing any Medicaid benefit available to the child, including benefits delivered under a Medicaid waiver or through a managed care organization. For all other children, the Bipartisan Safer Communities Act encourages interagency agreements with the goal of expanding access to Medicaid services that can be delivered in a school-based setting. And this technical assistance center was designed to help states develop strategies to that end. And with that, I'd like to now turn it over to Charlotte Steniger to discuss the considerations in implementing or enhancing school-based services in your state.
Thank you, Katie. We'll start by reviewing some considerations for implementation or enhancement of Medicaid SBS. To help understand the context that informed the work to increase students' access to Medicaid SBS, it's important to recognize what has happened. Prior to 2014, what we consider to be the pre-free care period, Medicaid SBS could only be provided to students with disabilities under the Individuals with Disability Education Act, or IDEA, in accordance with the child's Individualized Education Program, or IEP. In addition, SEAs had to ensure that provision of such services were at no cost to the parents. Since 2014, which we consider the current period of free care, Medicaid SBS can be covered for any student enrolled in Medicaid for any health service covered according to the early and periodic screening, diagnostic, and treatment rules. This includes, but is not limited to, routine preventative care, behavioral health, ongoing primary care and treatment, regardless of whether the students generally are charged for such services when furnished as SBS. And it's important to note that LEAs may obtain financial support for services that they may already provide. Let's better understand how Medicaid SBS expansion has occurred across the U.S. As of September of 2023, CMS has a record of 15 states who have fully or partially expanded their Medicaid SBS programs. All of them have accomplished this with a state plan amendment, or a SPA. A SPA outlines the changes to Medicaid state plan that the state intends to implement. For Medicaid SBS, these changes describe the methods and standards for reimbursing school-based health and related services. The SPA is submitted to CMS for approval. These changes were enacted for the purposes of bringing in additional resources to expand access to health services for vulnerable students and addressing the increased demand for mental health services in schools. Now, of those 15 states, there are 13 identified by CMS as fully increasing access beyond IDEA. As of September 2023, many states have not taken formal action to implement or align their state Medicaid plans, if necessary, with the 2014 free care rule. Note, states may or may not have to update their state Medicaid plan to achieve this. In a state's Medicaid plan, coverage pages are not required unless the state has information already in the state plan limiting this coverage. Payment pages are required. The state may already have payment in place. Carefully review your state Medicaid plan to determine if and how changes need to be made. To align with the statutory components of the BSCA, states can establish policies to allow all Medicaid-enrolled students to receive health care through schools. This does not have to be limited to only services included in a student's IEP, and it can include preventative care, mental health, substance abuse disorder services, and nursing services, such as medication monitoring and counseling, or any other services in the Medicaid state plan. Schools may seek payment for all Medicaid-covered services provided to children enrolled in Medicaid, regardless of whether the services are provided at no cost to other students. Doing this increases schools' abilities to draw down federal Medicaid funds for health services and increase access, improving health equity among low-income children. To better understand the Medicaid SBS adoption across the United States, states can be categorized as either IDEA states, states who have partially increased access beyond IDEA, or states who have fully increased access beyond IDEA. IDEA states are states who have not implemented Medicaid SBS beyond what is required by IDEA. This means there are indeed opportunities to implement Medicaid SBS. For states who have partially increased access beyond IDEA, these are states who have only implemented 1 to 2 Medicaid SBS or populations beyond what is required by IDEA, like nursing services or Section 504 children. For these states, there are opportunities to evolve their Medicaid SBS program. And lastly, for states who have fully increased access beyond IDEA, these are states who have implemented Medicaid SBS for all Medicaid-eligible children for a variety of services. For these states, there are opportunities to adopt new flexibilities. So CMS, along with the U.S. Department of Education, are working to promote student health and well-being by increasing access to Medicaid CHIP-covered services, providing options to ease administrative burden for existing and new services, and providing best practice examples and methods that SMAs and LEAs can use to provide and pay for Medicaid SBS. And for states, SMAs, SEAs, and LEAs should start their work by beginning to engage in a systematic review of the current state of the Medicaid CHIP services provided in their state, identify knowledge gaps among stakeholders, and provide education to inform the efforts to increase access to Medicaid SBS, and by building a coalition to do the work to implement or enhance Medicaid SBS in their state. So how does a state get started with the pre-implementation work for Medicaid SBS? To begin, states will want to engage in a comprehensive review and analysis to help stakeholders understand what is happening in the state and what is needed. Then, to ensure that all stakeholders are coming to the table well-informed, we'll talk about information that needs to be disseminated. And finally, we'll walk through the initial steps to building a strong and effective coalition. Of course, when embarking on such a huge and critical endeavor, it's important to understand who should be doing what. This table provides an overview of some of the initial steps to getting started to enhancing Medicaid SBS and the roles that SMAs, SEAs, and LEAs should play at each of these steps. Let's take a look at these steps a little more closely, and we'll begin with the comprehensive review and analysis. It's important to start by understanding the current state of your Medicaid SBS. By conducting a comprehensive review and analysis, stakeholders promote their understanding of the Medicaid SBS landscape in your state. We recommend that this resource is a product of a joint effort between SMAs and SEAs, and that it is prepared for everyone, including all state agencies impacted by Medicaid SBS, LEAs, and other legislative and fiduciary stakeholders. We recommend that this comprehensive review and analysis is informed by a number of resources, including the state Medicaid plan, state guidance, time studies, direct service billing, revenue and cost reports, community mental health plans, prior community health needs assessments, and audits, and other things. Understand that the purpose of this work is to provide a resource that outlines the current state of Medicaid billing of SBS and the rationale for identifying changes or implementing Medicaid SBS. Now, the intent of the comprehensive review and analysis is to bring together information regarding the current state of Medicaid SBS in your state. It informs current policy and service provision for Medicaid SBS, identifying any issues with implementation of current policies and gaps in addressing student health needs. The work should provide an opportunity to involve interested LEAs. So you may want to aim for LEA representative sample like inner cities, rural, tribal, or even charter schools. And be sure to share this information with all stakeholders at the school district level and up. Now, this may include a community health needs assessment. Here's a link to the CDC page on community health assessment and health improvement plans. We will be sharing this link on a resource slide at the end of this presentation as well. Now, there are many avenues to approaching the comprehensive review and analysis, but here are a few recommendations for your consideration. It's important to define the highest priority student health needs in the schools and community. Now, this could be defining a broad need, like a behavioral health center, or maybe more specific, like not having a certain type of provider to service an LEA. As mentioned before, a community health needs assessment can inform this or other health promoter models like Precede, Proceed. Again, we'll be adding this link to the resource page that is going to be found at the end of this presentation for Precede and Proceed. Now, determining the health services that students have access to in schools and the provision methods that can promote understanding amongst all stakeholders. Now, this includes listing what specific services are currently offered in the school and how they're being provided. Understanding the disparity in services is critical here. A utilization review can help the effort in understanding what services are most used and which ones are most needed, or other types of service-related information. In addition, here is the one place where you can determine if there's any policies that may not be in alignment with the IDA requirements. It is essential to identify the health services covered by Medicaid in school-based setting. Now, the services that are being provided in school must fit within the Medicaid state plan amendments, and state guidance. However, schools may not be providing all the services as identified within the plans. Understanding the difference between what is actually covered by Medicaid and what is actually being provided is a great start to understanding the current state in your school. This gap analysis can be a critical step in realizing the challenges with service provision at the school level. In addition, states may want to carefully consider what is included in the federal regulation ECFR Title 34, Part 300.4, that talks about what is considered related service. Understanding the restrictions on the type of providers that can be reimbursed for delivering Medicaid-eligible services is also important. Each state has provider qualifications and associated requirements outlined. In some cases, there are federal requirements as well. It's important to understand what these are and how these impact the type of providers your LEAs can use. And finally, defining the systems that are in place to support your state's school health service program should also be considered. Now, this can include outside contractors or partnerships that could help bolster your provider roster. Now, we want to shift our focus a little bit and talk about an example of how North Carolina collected a tremendous amount of data and identified school-based services eligible for Medicaid federal matching that were not being reimbursed under the North Carolina state Medicaid plan at that time. The analysis described the financial impacts of covering proposed services and conducted research on SBS could be added to North Carolina's state Medicaid plan. Given that these services were already being provided but not being reimbursed, was a great way that North Carolina could enhance their Medicaid SBS program, targeting some of the lowest hanging fruit. Now, the data that was included in their comprehensive review and analysis included service utilization data provided by the Department of Public Instruction, or DPI, current procedural terminology, or CPT codes, current North Carolina rates for service, and rate research from select states that was used to inform fiscal impact projections. Historical data from a state's fiscal 2014, 15, and 16. They were used to identify submitted LEA provider claims for service. and a number of Medicaid beneficiaries who have historically received services as stipulated on an IEP, IFSP, 504 plan, or individualized health plans. With this review and analysis, North Carolina provided a legislative report to the Joint Legislative Oversight Committee on Medicaid, the North Carolina Health Choice Program, and the Fiscal Research Division, which all resulted in a recommendation for additional services and enhancements of the current Medicaid SBS program. And the final outcome of these efforts resulted in North Carolina fully increasing access beyond IDEA. Remember, how did North Carolina get started? By engaging in a comprehensive review and analysis. So for IDEA only states, this includes data gathering to inform healthcare needs of the students and determine the best billing methodologies to implement. Whereas this is a sampling of the data that can help inform the work moving forward, there are a few items here I'd like to emphasize. Community Health Needs Assessments, or CHNAs, are a legislative requirement. Also called a community health assessment, it refers to state, tribal, local, or territorial health assessments that identify key health needs and issues through a systematic, comprehensive data collection and analysis. Now, schools may have a designated community school coordinator that can help with this needs assessment. Now, states can also look at social service program data to see which schools are Title I or may have a large free or reduced lunch population. For Medicaid managed care contracts, you want to ensure alignment with the IDEA requirements of no cost to families and no reduction of services outside the child's IEP, IFSP. Now, for those states with partial or full increased access beyond IDEA, data gathering is conducted to inform how the healthcare needs of students may have evolved and determine the best billing methodology to implement. As you see here, there is a bit of overlap, but specifically this review, you may want to focus on these additional items. I'd like to focus on a couple of things here. It's really important to get school-based provider input. And these are the providers that interact with the students day in and day out. Now, this could be done via a school survey, a student record review, or even focus groups. Now let's take a look at the roles and responsibilities related to the comprehensive review and analysis. Now, SEAs and SMAs, they actually kind of both take a leading role. The SEAs specifically engage in the data collection to describe the state's landscape of the current Medicaid SBS, but SMAs actually use that data to inform possible enhancements. Now, your LEAs, they really support and inform this role, and by assisting the SEAs in providing information and cooperating with study and evaluative activities. Now, I would like to turn this presentation over to Nicole Clark to talk about important information to disseminate amongst stakeholders. Nicole?
Thank you, Charlotte. Now we will take a look at how states can engage in opportunities for information dissemination to promote Medicaid SBS enhancement. We will start by understanding what exactly we are talking about when we are discussing information dissemination. Information dissemination is the action of distributing or broadcasting information. The data from the comprehensive review and analysis will serve as a keystone in understanding the work of the coalition. The dissemination of those findings may result in a number of initiatives. Promote understanding of initiatives, which may lead to determining provider service gaps. Provide context for decision-making, which may help in identifying the best payment methodology. Encourage informed discourse, which will help in determining the service needs of students. Promote understanding of the current state, which may help inform the work to ensure appropriate implementation of IDEA and Medicaid requirements and correct any policies that are out of alignment. Now that we understand the importance of information dissemination, let's identify the areas where we think states may see the biggest benefit in these efforts. They include sharing information regarding a state's current Medicaid plan and any state plan amendments, a state's Medicaid guidance for SBS, opportunities for the initiation or evolution of Medicaid SBS from the perspective of LEAs, how health equity is promoted in schools, and Medicaid managed care plans and how those details impact service billing and delivery of IDEA and non-IDEA students. Now we see the beginning of this work as having all stakeholders on the same page about the current Medicaid state plan and state plan amendments. Service reimbursement and eligibility levels are outlined in each state's Medicaid state plan. This agreement between a state and the federal government describes how the state administers its Medicaid program. The primary responsibility is of that of the SMAs, and the recipients are SEAs and LEAs. This is the starting point for your discussion regarding how your state can implement and enhance Medicaid SBS. In this process, you may identify policies that should be marked for revision. Also, SEAs may start identifying gaps in provision or payment and/or rationales for these gaps. The purpose of this work is to ensure that all key stakeholders understand the current Medicaid state plan and to inform them about what changes need to be made. For the current Medicaid state plan, SMAs should lead this effort as they are responsible for the state Medicaid plan and amendments to that plan. SEAs and LEAs are the recipients as they utilize that information to understand the scope of reimbursement for Medicaid SBS. Next, it's important to share information regarding how direct care and administrative services are being provided to the school. So the key function of this effort is to review the analysis of the current provision and payment of Medicaid SBS, comparing it to what is allowed in your state's guidance. SEAs are responsible for sharing what is happening at the LEA level, and LEAs validate and inform. SMAs are the recipient in order to identify where the gaps in service provision and reimbursement are. Use the comprehensive review and analysis to glean information regarding implementation of state guidance and related policies. Ultimately, this should inform considerations when looking at Medicaid SBS enhancements. The purpose of this work is to foster understanding of the delivery of current Medicaid SBS, as understanding your state's implementation of current SBS policies is critical in expanding and streamlining Medicaid reimbursement. The intent of this effort is to inform stakeholders of the details regarding the implementation of current guidance, as this information may help identify misunderstandings, challenges, and barriers in implementing a state's guidance, determine need for additional training, resources, and supports, and inform service provision solutions that could help other LEAs in the state. As far as roles for this step, SEAs play a leading role in providing information regarding how Medicaid SBS is delivered to help inform SMAs how Medicaid SBS is actually implemented. SMAs are the recipient of the information and utilize this information to understand provision and billing gaps and help provide context and consideration for enhancing Medicaid SBS. LEAs support and inform SEAs on the actual provision of services and program administration at the school level. Another key piece of information is from the perspective of the schools and LEAs on where there may be opportunities to improve access to Medicaid SBS. With this effort, schools and LEAs outline opportunities for providing and billing direct care and administrative services that currently do not exist or do not meet current needs. This would be done through the creation of a resource that would define the service needs, billing solutions, and provider options for meeting those needs. These resources should outline the service needs specifically for those students with IDEA required services and those that do not have IDEA required services. This is a joint effort for SEAs and LEAs, with the recipient being SMAs, who are meant to inform next steps. We believe that identifying opportunities to implement or evolve current Medicaid SBS requires input from all, but starts at the LEA/school level. as the purpose of this work would be to identify problems, concerns, and issues that the LEA and school level to inform next steps. The intent of this effort is to inform the work of the coalition by identifying the healthcare needs of students from the school/school-based provider level. This information should be categorized by those students covered under IDEA requirements and those who are not. Information should include healthcare services that currently meet the needs, healthcare services needed that are not currently provided and related benefits, and services that are currently billed/not billed, identifying what is the gap. This is critical information necessary to help inform the coalition. Now, for this effort, we see LEAs taking a leading role as they pull together information and metrics regarding student health needs and opportunities to expand services. SEAs support this effort as they provide additional information and supplemental data. SMAs utilize this information in determining the approach to implement or enhance Medicaid SBS. Now, we also need to consider how health equity is addressed in schools. Understanding the current initiatives and plans that address health equity in schools is essential in decision-making. Therefore, we recommend that SEAs and SMAs engage in an effort to provide stakeholders with resources that outline and inform how health equity is addressed in schools. This is further informed by LEAs who have boots on the ground and understanding the efforts to promote health equity. Now, these resources should align with the state's health equity strategy, which includes health department and SMA's quality improvement plans, includes initiatives to promote Medicaid eligibility and enrollment. In addition, this resource should be reflective of the 2024 mandatory core set of children's healthcare quality measures for Medicaid and CHIP, which reflects high-quality comprehensive care across healthcare providers and settings. A link to the 2024 core set of children's healthcare quality measure for Medicaid and CHIP will be included on the resource side located at the end of this presentation. Ultimately, the purpose of this effort is to identify potential priorities to address and align with the state's health equity plan within LEAs. The intent of this work is to inform the work of the coalition by identifying how the state's health equity strategy is currently addressed in schools. Resources can inform alignment with the state's health equity strategy, status of health equity in schools and current initiatives, and opportunities on how increasing access to Medicaid SBS can promote health equity in schools. So for this work, we see it as a joint effort between SEAs and SMAs, where they work together to understand how the state's health equity strategy is reflective in the current Medicaid state plan and within SEA policies related to Medicaid SBS. LEAs help inform this effort by providing details about how current Medicaid SBS is addressing health equity in schools. Another important piece of information that is important to share in how Medicaid managed care impacts care delivery and billing within your state. So we recommend that SMAs provide resources and/or training that details how the state approaches Medicaid SBS in accordance with MCOs. SEAs and LEAs are the recipient of that information. SBS may be included, carved in, with the managed care organization contract or carved out under fee-for-service. If included, this resource should inform which services and provider types are included within the capitation rate. Note, there cannot be a limit on the services against the capitation rate for IDEA kids. Medicaid managed care organizations are prohibited by federal law to reduce any Medicaid benefits to students who receive IDEA services. For the Medicaid managed care plans, the intent is to inform stakeholders on how MCOs may impact the provision, delivery, and/or billing of Medicaid SBS. The information should include the different services that can be provided and types of providers who may participate in the plan's network, and be clear that there cannot be any reduction of benefits to students who receive IDEA services. Ultimately, this should lead to a larger discussion with the MCOs. This resource should promote key understanding for stakeholders for states with services carved into the MCO plan. SMAs play a leading role as they share information regarding the MCO's plans. It's important that they identify whether SBS is carved out of their state's managed care plans or carved into the program. SEAs and LEAs support and inform this work as they identify how this information could impact plans for changing Medicaid SBS provision and billing. In states where SBS is included in the Medicaid managed care plan, SEAs and LEAs should provide information on cost to inform managed care payment rates. Let's take a minute to look at an example where a state engaged in a major effort to disseminate information to stakeholders to help support and promote the implementation of Medicaid SBS. The Massachusetts Medicaid program, Mass Health, works in conjunction with the University of Massachusetts Medical School to administer the school-based Medicaid program. Mass Health offers a resource center where guidance documents, forms, and other resources are available to individuals for successful school-based Medicaid program participation. Resources include general program information, random moment time study guides, administrative activity claiming guides, direct service claiming resources. Mass Health also offers trainings, including a one-on-one series providing appropriate introductory information about the Medicaid program that is most pertinent to varying LEA roles. The link for the Resource Center can be found on the resources slide at the end of this presentation. With that, I will turn it back over to Charlotte to talk about building the coalition.
Thanks, Nicole. Now that we've covered some of the basic information that should be disseminated to help inform the work of your state to advance Medicaid SBS, let's talk about the work to build your coalition. Some of the initial steps to building your coalition are outlined here. They include identifying key stakeholders, establishing coalition expectations, and promoting coalition understanding. We'll explore these a little deeper to help outline the considerations for each. We'll start by identifying the key stakeholders that should be part of the coalition and engage in outreach activities. These key stakeholders should include Medicaid agency finance staff, SBS staff, eligibility and enrollment staff, and managed care staff. Outside the SMA, but within the Department of Health, should include policy and legislative affairs staff and health policy strategy staff, which may include the governor's office. More specifically, for state Medicaid agencies, key stakeholders can include the Medicaid director or deputy director, depending on the direction of the coalition's policy goals. The group may also want to engage in staff with expertise on issues such as benefits and coverage, managed care contracting, school-based Medicaid programs, the claiming and reimbursement process for schools, and the process of credentialing schools and school-based providers for Medicaid. It's also important to include Medicaid legal counsel for questions on medical necessity, consent, data sharing, and documentation. And for state education agencies, identified stakeholders may be the chief state school officer or key deputy staff who oversees school-based Medicaid program, special education, staff who engage in efforts to advance safe and supportive school environments, and staff members who oversee school health grant programming, including the CDC and Prevention 1801 grants and Project Aware grants. It's also important to include the state education agency's legal counsel for questions related to data sharing and contracting. And finally, for local education agencies, key stakeholders may include a district superintendent or deputy, school board members, district budget director or legal counsel. And other partners may include special education directors, LEA billing specialists, school nurses, speech, occupational physical therapists, and other school-based providers, as well as unions representing in-school staff. Once you have established who will be part of your coalition, it's important to establish expectations early. This should be a collaboration between the SMAs and SCAs, and key to this work in establishing clear expectations for meeting participation. In addition, it may be helpful to define the following: the coalition's purpose, objectives, and goals, the role of each participant. Maybe it's to inform, make decisions, guide, or validate, right? The committee and committee assignments, meeting processes, including structure, facilitator, flow, and agenda, establish routine dates and times to promote attendance, and determine the metrics by which all work should be measured. Now, it's important to set clear goals for each coalition meeting and concrete next steps. All deliverables should have owners and target dates attached to them. And the key purpose to this work is to create an agreement for all stakeholders that establishes the approach to implementing or enhancing Medicaid SBS. To delve a little bit deeper into the formation of the coalition, we mentioned that establishing goals and objectives are fundamental to this work, in which SMAs and SCAs should collaboratively engage. This work is critical to understanding the path forward. Now, we understand that healthcare and education use different terminology to describe similar concepts, and this can lead to confusion and misunderstandings. So coming together to identify and agree upon terminology around policies that support Medicaid SBS is essential. Identifying the discrepancies in terminology can start by reviewing the comprehensive review and analysis. Once agreement on terminology is achieved, then this information should be disseminated to all stakeholders, and that terminology should be consistently used in instruction, guidance, and resources produced and revised moving forward. When promoting coalition collaboration, it's important to consider the questions that team members may have when engaging in this work. Here are a few topics and questions you may want to consider as the team is forming. Think about goal alignment. Like, for example, a stakeholder may question, I know my agency goals are with school-based Medicaid, but how do our goals align with other agency goals, and where do they overlap? Perhaps consider perspectives on programs. For example, my organization runs a program that supports student health, and we have significant perspective to offer on how to improve programs across the state. What data do we have to share about how our program works? And can we collaborate with other agencies to move these goals forward? Maybe think about the contributions to improve Medicaid SBS. For example, we have committed to the improvement of the school-based Medicaid program, and we have staff time to dedicate. What resources can we contribute to the coalition? Can we play the role as a facilitator? Or is there a role for us to play in advancing this work? Maybe you're new to the coalition, but you have significant experience with school-based Medicaid. How can my agency bring value to the coalition? Or what can we take on to advance this work? Also consider supports for enhancement. Maybe you don't have support from all key agencies and parties. What are their priorities? And how can school Medicaid support these priorities? Who are the decision makers, or who might have influence over them? Could it be a state legislator, school district voices, or other agencies? To review, this effort to build the coalition is led by the SMAs. They determine the participation structure and expectation of the coalition. SCAs and LEAs play an essential role as well, as they work to promote coalition understanding by providing context and perspective. Now that we have reviewed some of these initial steps to getting started with Medicaid SBS, let's take another look at this graphic. Getting this endeavor off the ground and running takes a thoughtful and planned approach that engages all levels of stakeholders. And as we reviewed, SMAs, SCAs, and LEAs each play a critical role in this work. To review, with the goal of increasing access to Medicaid SBS, the Delivering Services in a School-Based Setting, a Comprehensive Guide to Medicaid Services and Administrative Claiming was released in May of 2023. Now, many states have not started the work to implement Medicaid SBS. However, in this training, we provided the steps to getting started, including gathering data and information, disseminating information, and building a coalition. We discussed the action steps necessary to take to get this work started, the responsibilities of key stakeholders, and the intended purpose of those steps. So this was a good review of those steps to getting started, but we do have more to offer. Please remember to join us for our next webinar on determining direct care and administrative services for Medicaid school-based services. This will be held on October 19th, 2023. This webinar will cover more information regarding coalition work, directed administrative services, and some considerations for revisions to a state's administrative services claiming guide. And with that, I'd like to take some time to allow for questions and turn this over to Nicole. Thank you.
Thank you, Charlotte. Please feel free to put your questions either in the Q&A section located at the bottom of your screen, or also within the chat for us to go ahead and answer. I know that there was a question previously answered asking if the slides will be shared today. Yes, the slides will be made available following today's webinar on the Medicaid.gov website. Please be on the lookout for an email when those become available. I see there's a question too from Lauren about the upcoming webinar. Yes, that will be at 3 p.m. Eastern as well, and we'll add you to that appointment. We'll go ahead and give it a few more moments for people to put questions within the chat. There is a question that is coming in that is, how does CMS expect states to handle expanding SBS when the state has both MCO and fee-for-service options for providing SBS? Richard, would you like to, I see you're typing it there, or I don't know if you want to speak on it out loud.
Sure, I can just, I mean, it really depends on what's going on in the state and what's happening and what services they wanted to expand. If there's, I mean, you might have to make, like North Carolina did, it looks like they've made some agreements with some managed care organizations to provide certain services, right? And then also fee-for-service options. So it really greatly depends on what's going on in your state, what the source of funding is, right? So if we can kind of get those answers, then we can kind of help you a little bit better. But generally speaking, we don't expect states to do anything. It's completely voluntary, of course. We think that there's a real advantage to providing school-based services, that are, Medicaid can pay for both those IDEA services and any other expansion populations that are possible. So we would encourage that. We don't expect it. Please take advantage of the flexibilities as much as possible. And we will definitely work with you to work with your specific situation, but let us know. You can write to, either the school-based services mailbox or, contact us in some other way, shape, or form, however you'd like. Thanks.
Thank you. I see we have one as a community-based stakeholder. Are there tips on how to engage SMAs to begin working on this issue? We will actually be having a presentation about this, Rebecca, in the new year to provide some tips and some best ways to help better engage your SMA and SEA. So we look forward to you attending that presentation. Another one we have is, are states required to have multiple cost pools, admin, direct, etc., for their Medicaid administrative claiming?
And I could chime in and just say, it depends on what you want to claim for. If you want to claim for direct services, if you've got a provider that is 100% medical and that's all they do, then they don't even have to do a time study, right? They can just be on the cost report, for instance. If you have someone, the only time they are going to be in a cost pool is if they have a variety of different services that they're doing, like administrative and direct and maybe a bunch of other educational services, let's say. Then they have to be in a time study to differentiate those times and allocate that time potentially between different activities like administrative and direct and educational. So are you required? No, because you don't have to claim for admin if you don't want to. You don't have to claim for direct services if you don't want to. You can claim for one or the other or both. It's totally up to you and how you design your program. And it may be at the state level, they may give the option of certain LEAs to do only direct or only administrative. That just depends on the sophistication of the program and how you guys would like to do it. We encourage you, if you want, to take advantage of the administrative claiming as well as the direct services that are provided for the children. We think that would be advantageous.
Please note the TAC and CMS are here to help with any questions that you may have when you're trying to determine your cost pools. So please feel free to reach out to get any clarity that you need as you are determining the different cost pools within your state. Okay, I see we have a few more questions. We'll do one more question before we wrap up today, as I know we're coming up on the top of the hour here. How are states able to prevent a duplication of service? For example, if a child sees the provider at the school and goes to the FQHC after school for the same services.
I don't really have a great answer for that. That's a lot of it is how you design the program and kind of what happens. But there has to be parental consent, right, for any services given in school. So that's one way that they can control it. But I'm sure that there's other ways that internally there might be some controls. And that's something that we're going to work on and continue to do with the best practices and see what other states are doing in terms of making sure that those services aren't duplicated. So coming up.
Well, thank you all very much for your questions. All questions that were not answered during this time, we will be providing in a QA document following today's call. Go ahead and go to that next slide. So thank you all for joining the Getting Started with Medicaid SBS webinar. The slides, Q&A, and recording of today's presentation will be made available on the Medicaid.gov website, which we will also send out an email to allow you to know when that recording and slides and Q&A have been available. Thank you all again and enjoy the rest of your day.